The vitamin deficiency behind sleep apnea. Hi, I'm Dr. Raylee. Welcome to my channel. I want to discuss with you a very important topic. It is about your sleep, the disorder called sleep apnea. What is behind this disorder in relation to nutritional deficiencies? So, correcting this vitamin deficiency can make tremendous positive effects on sleep apnea. What at all is sleep apnea? Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts whilst you are sleeping. The main type of sleep apnea includes obstructive sleep apnea, which is the most common type. Then there is the central sleep apnea, and lastly, the treatment emergent central sleep apnea. The symptoms of obstructive sleep apnea and central sleep apnea overlap, sometimes making it very difficult to determine which type you have. But the most common symptoms of obstructive and central sleep apneas include number one, loud snoring. Loud snoring can indicate a potentially serious problem, but not everyone who has sleep apnea snores. But if you experience this, please see your physician. Also, episodes in which you stop breathing whilst you are sleeping, which will be reported by another person, and then gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep known as insomnia, excessive daytime sleeplessness known as hyperinsomnia, difficulty paying attention whilst awake, and then irritability. Now, there are two major risk factors for sleep apnea, and they include obesity and people with diabetes. Other risk factors include family history, older adults, heavy smokers and alcoholics, nasal congestion, and certain medications. Now, what is the vitamin deficiency linked to sleep apnea? There are two. The first one is a vitamin B1 deficiency. Studies have shown a link between vitamin B1 deficiency and sleep apnea. Vitamin B1, also known as thiamine, is essential in maintaining normal function of your brainstem. These are the breathing centers, that is the medulla and the pons. They are involved in the regulation of the ventilatory pattern of respiration and connects to a nerve called the phrenic nerve into the diaphragm. Now, the movement of the diaphragm is majorly involved in the breathing process, controlled by this nerve called phrenic nerve. So, if this nerve is cut off, you're not going to be able to breathe. And breathing, is under the autonomic nervous automatically, and vitamin B1 is essentially involved in this process. So, when you stop breathing whilst you are sleeping, or let's say your spouse is snoring and all of a sudden they stop breathing, that is sleep apnea right there. And with persons with diabetes, the higher sugar deplete vitamin B1, and then you lose the function of the breathing centers, and the nerve cannot trigger the diaphragm to breathe properly. So if you have sleep apnea, you will want to take vitamin B1 supplement, and in addition to that, you can take nutritional yeast that will support and prevent other deficiency from high levels of vitamin B1. Now, there are different varieties of vitamin B1. The first one is called thiamine hydrochloride, a water soluble form of B1. It is the most common type, but its bioavailability is generally low. The one that I recommend for you is called benfotiamine, a fast soluble form of thiamine. It has better bioavailability and efficiently crosses the cell membrane, including the blood-brain barrier. And benfotiamine is often used to manage neuropathy and other nerve-related conditions. Another one would be what we call the sibutramine. It is a synthetic fast-soluble derivative of thiamine, and it has better bioavailability and also blood-brain barrier penetration. And sibutramine is often used to enhance cognitive function, your mental fatigue, and even improve your mood. But what I recommend for you will be the benfotiamine. It is a natural form. Now, the second vitamin associated with sleep apnea is vitamin D deficiency. Vitamin D is technically a hormone, but it is a fat-soluble vitamin with an important function in calcium absorption and homeostasis, which is also implicated in the several non-skeletal conditions. And recent data suggests that in obstructive sleep apnea syndrome, patients' serum levels of vitamin D are lower compared to non-ethnic subjects. And vitamin D receptors have been identified in several brain areas, including the hypothalamus, which, among others, regulates the alterations in the sleep and wake cycle. So, I would recommend, in addition to taking vitamin B1, you get for yourself a vitamin D3 with K2 supplement and support with other cofactors like zinc and magnesium, and you will significantly see improvement with sleep apnea. So if you know anyone who has sleep apnea or you yourself have sleep apnea, I recommend for you vitamin B1 and then vitamin D3 with other cofactors. Alright, thanks for watching, and I will see you in the next video showing right on the screen. Check any of your choice, your health, your life. Thanks.